Good evening, dear viewers, and welcome to a new episode of Medical Talk, the program that brings trusted medical knowledge closer to everyday life. A healthy smile is not only about appearance, it affects how we speak, how we eat, and how confident we feel in our daily interactions. Over time, many people experience tooth loss, damage, or changes in their smile, whether due to age, dental disease, or unexpected circumstances. And while these changes may seem challenging, modern dentistry today offers advanced solutions that restore both function and natural aesthetics. Tonight, we focus on dental restorations and prosthodontics, a field where science, precision, and care come together to rebuild smiles and improve quality of life. To guide us through this important topic, we are pleased to welcome Dr. Balqees, Almomen, a prosthodontist who will help us understand modern dental restorations, patient-centered treatment choices, and how the right approach can make a lasting difference. Stay with us. You're watching Medical Talk. Welcome back. We're honored to have with us in the studio Dr. Balqees Almomen, a prosthodontist. Dr. Balqees, welcome to Medical Talk.
Thank you for having me.
Thank you so much.
Thank you.
We have so much to talk about. As a dentist, I got to tell you, one of the most fascinating fields that I like in dentistry is prosthodontist. But before we dive into more details, I would like for you to explain to our viewers, what do you do and what do we mean by prosthodontics?
So prosthodontics is a term in the dental field, or it's a specialty rather in a dental field, where we look at restoring teeth and to restore the function, to restore the aesthetics of the patient and the overall well-being. So our specialty focuses on things like veneers, crowns, bridges, all the implant work, and some of the removable prostheses. And so the overall aim is just to restore the aesthetics back to how the patient was initially.
Okay, because the reason I ask you this is because there is a misconception. People, they don't understand or they can't distinguish between general dentistry, who can do fillings and other things as well to improve the smile, but they have no idea what's the difference between a general dentist or general restorative dentist with a prosthodontist. Can you dissect this a little bit deeper?
So in general dentistry, so a general dentist should be able to do all these basic, let's say they are in some situations challenging, but they are all about, restoring the form of the actual tooth. Whereas for us, we are trying to, replace missing teeth or replace the tooth structure using, indirect type of fillings or indirect type of restorations, such as veneers and crowns. And our work is very complex. So it actually, involves having the patients on multiple occasions. A very, detailed diagnosis and treatment plan need to be followed. In addition, we actually also work with other team members in order to get to the final result, along with the lab technicians on the other side to help fabricate all of these type of restorations, which we usually call indirect. So our specialty mainly focuses on those type of restorations which are indirect, that need the help of external labs and other team members in order to get to the final result.
Exactly. And also, correct me if I'm wrong, is also more related to a full mouth rehabilitation, not just a single tooth.
No. So in some cases, it's it can range from a very simple filling up to a veneer, a single crown, or a full mouth rehabilitation, where it's a more extensive work where the patient needs more of a complex rehabilitation to restore his aesthetics or function, where they've lost multiple teeth, and it can be to many reasons.
Exactly. Now, from your perspective, how has the field been evolved, the field of prosthodontics? Because we know we came a long way. Now we have the technology, and we'll be able to do multiple things that we were not able to do, like maybe I'll say 15 years ago. So can you explain to us the evolution of restorative and prosthodontics, basically?
So in dentistry, it has been, you know, tremendously evolved over the years. So we have moved from, you know, trying to replace meticulously whatever we see in the patient's mouth to trying to restore and maintain whatever we see. So dentistry have moved to more of a conservative approach rather than, you know, replacing any missing teeth or any missing tooth structure that we see. So things like, you know, adhesive dentistry, where we actually use onlays or inlays, have been evolved. In addition, the materials of the ceramics, so they have been, you know, more in the past, they have been let's say in some situations we use those ceramic restorations in order to improve the aesthetics, but in terms of strength, they're poor. Whereas nowadays, all the ceramics have been evolved to a much stronger type of restorations, but not just strong restorations, aesthetics. So things like zirconia, things like the lithium disilicate. So these are the materials that we are heavily dependent on nowadays to restore the teeth.
I guess,
smiles.
I guess it's worth to mention as well for our viewers that it's not only the ceramics that we, or the crown, the material for the crown. We are also keen on even the color of the cement sometimes we use, you know, because it could affect.
It does change the overall result. So, you know, as a prosthodontist, we always have to have in clinic something called a try-in cement or a try-in, which is the it's a trial. So once we receive the final product, we usually try it in the clinic. In this material, such a material which is a try-in paste, and it's easily washable, just to help, you know, visualize the final result. Because it does, you know, lots of factors play a role in the final result, especially in aesthetic cases. So the cement, the type of, you know, the type of restoration or the material that we are using, the actual tooth color itself affect the overall result. So you have to be very, you know, very meticulous when you try and treatment plan these cases.
Exactly. I'm saving the best for last, which is I'm going to ask you about like how to choose what for which case.
Yes.
Okay, because every patient is different than the other. Okay, depends on many factors. Okay, but I want to just take a sit back. I want to take you back to the two main branches, or I would say, of prosthodontics, which is we have removable appliances, removable applicator, and then we have the fixed applicator. A lot of people, they might not understand or like comprehend the difference between those two branches. So could you explain that to our viewers?
So in both, you know, in both branches, it's about, again, prosthesis. So providing the patient with prosthesis that will help them to function and to talk. In the removable, it's a type of prosthesis where we give the patient, but they are able to remove at night, and we usually provide them as, you know, a temporary solution in some cases, and as a definitive treatment plan in other cases. Whereas in the fixed prostheses, they are actually fixed in their mouth, so you are not able to remove those prostheses. So once they are, you know, cemented in place, they are there. The patient is unable to remove them. However, maintenance plays a big role in those cases.
Exactly, and you have to be selective on which one is more suitable for the patient.
Of course, and to be honest, now, you know, we are, you know, I personally still use removable prosthesis in a lot of cases. Where it is actually required and we don't have any other option. But nowadays, a lot of people are not accepting these kind of restoration. They want something fixed to, you know, help them feel that it's, you know, as natural as possible. So and you know, with the advent of implant, the implant world, we are, alhamdulillah, we are able to provide that with the patients.
Yes, the implant came a long way, and the evolution of implants as well. But again, you know, we're going to talk more about implants later. You know, because some people might be a good candidate for an implant, and some people can't, due not only because of their age, but could be due to their medical history. I want to ask you about how important is for you as a prosthodontist. Would you prioritize aesthetic or function? This is a tricky question.
And to be honest, I can never work with one and, you know, disregarding the other. So it's always both together. So we always focus on function, the patient safety first. Aesthetics obviously plays a big role. But you want to be able to provide the patient with something sustainable, something that will stay there for a long time. So it's dentistry is not just about a one-day job where you just provide the patient with something and then let them go, and then because they will keep coming back. So you want to provide something that is long-term and can be maintained.
Yes.
So yeah, I think both come in hand,
but
together.
I think if I don't know if you agree with me. I think the aesthetic is the foundation that we build on.
Yes.
And then I'm sorry, the function. Sorry, the function is the foundation.
Yeah.
And the aesthetic comes on, after. If you have a good, solid foundation for a good function, okay, then you can build aesthetic around it.
Really nice,
according to the patient's need and what could be acceptable for them, because function is I think it's the most important thing.
The most important thing. But sometimes you get those simple cases where it's just about improving their smile. So the patient presents having a full set of teeth, really nicely aligned, and the only thing they want is just a bright smile.
Yeah.
So in such cases, we would say it's purely aesthetic. However, we do have to pay attention to any underlying diseases. So if such cases present with gum diseases, or let's say caries or tooth decay, obviously we will have to treat this to get a strong base and then move on to the next step.
Absolutely. I still have more questions, but we're going to have to take a short break and watch a short report, and we'll be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Balqees Almomen. Dr. Balqees, before the break we were talking about the restorations and the field of prosthodontics in general. We kind of touched lightly on the implants and the aesthetic. I want to dive into more details about that, but before I will take you to that part, what do you recommend, what do you give your patients like tips for taking care of their restorations in general, whether it's removable, whether it's fixed? What do you give your patients instructions?
So are we talking about the post-operative instructions? So now we provided, or before?
Yeah.
So to be honest, in general, before even starting the treatment, this is what I usually advise, and then I keep reinforcing that at every single visit. Please brush twice a day. And brushing alone is not enough. So you have to, brush your teeth twice a day. You have to use a floss, and we have to, pay attention to the type of floss that you use. So if you have, a full set of natural teeth, a floss would do the job. And in some cases, a water floss is good enough. Other cases where they are having, bridges, then a certain type of floss should be prescribed. So it's called a super floss.
Yes.
And surprisingly, I've seen a lot of cases where they have been having those bridges for more than 10 years without having anything cleaning under those type of prosthesis. So it's very important to educate the patients and to be able to maintain,
because they don't know. Some of them they don't know.
Yeah.
So
most of them are like, no, I've never heard about this. What is super floss? So yeah, it's things like that are very simple. Just try to educate them, and then this will help maintain those prostheses for as long as possible. For others who are wearing removable prostheses, what I usually recommend is keep them out at night, and simply just follow soap and a soft brush, and just stay away from toothpaste. So it's usually not advisable. So yeah, a simple soft brush.
And see your dentist every 6 months.
Oh yeah. Yes, of course. So the checkups every 6 months, and professional cleaning as well.
Absolutely. Nowadays, with social media and basically the influence that exerts on patients, one of the challenges that we face every day in the clinic is the high expectations, sometimes from patients, and the unrealistic, sometimes, requests by patients. I can't tell you how many times a patient comes to your clinic and tells you, like, I want my smile to be such a, so and so.
Yeah.
Okay. How do you address that with your patients in terms of the social media influence and sometimes the misleading information, and also how to manage their expectation?
So, again, educating the patients and trying to show them every single step, and explaining what actually works for their, face, for their skin tone, for their personality, you'd be actually surprised how much they would change their mind. Yes, we can all say, I think the social media has, played a big role in, educating our patients. So I had a lot of patients who come to clinic and they ask me really deep questions, and I'm like, wow, I'm impressed how much information and how much dentally aware they have become. But in terms of managing the expectations, what I usually do is, I get the mirror out and I just, try to explain to them all the, all my views, what I actually think. And I would say almost, all of them would actually agree with me. Now, if the patient, let's say, if they are, not on the same
same line,
same line, yeah. Or I was not able, to let's say, to change their minds, then, I would explain that, the expectations cannot be met. But what I actually find useful is sometimes I do actually a try-in in the clinic using, simple materials like, the white filling that we usually use for restoring cavities. And I try to show them what the result might be.
Yes.
Another nice thing is the digital smile design nowadays. So the digital smile design is something that, we are able to produce in the same visit. Within 10 minutes, you can show the patients what their smile can look like. And obviously, with all the changes that you have previously explained to the patient, that everything, becomes clear, and that way you lower their expectation. And make them, understand what is actually more reasonable and more, suitable for their personalities or face or,
all of
those.
I guess one of the challenges that you might have, and I've heard this from other prosthodontists, is that how to convince the patient with the appropriate shade of their teeth, because this is one of the things that the patient will not completely realize until
you actually provide the
exactly.
final product.
Once we do the final cementation and they look at their teeth, and they might not be happy initially in the clinic with the light sitting, with the lighting, but once they go out and with the daylight and mix with people, and then they receive some comments, for example, and they're like, oh, they are too bright or they're too fake. Like, how do you come in terms with the patients, or how do you convince them about what's appropriate shade level,
the
best shade?
So again, what I said is, there is, a period of try-in. So in the try-in phase, where we provide them with the provisional, let's say the temporary restorations, we can, give them an indication of how the color would be, or the final shade would be. So I usually gauge if the patient would like something bright. I usually provide that in the provisional, phase or the temporary phase, and see how they react to that. Another step that we can, try the final restorations or the final prosthesis is when they arrive, we put the cement, but temporary cement, and get them to try it on, go as you said, because the tooth actually looks different under different lighting conditions. So if you stand here, it would be completely different under daylight, under,
especially here in the studio with our, all the lights.
Yes. So it's just a way to help them, understand how it will blend in, and then, if they are happy, we'd move on to the final step. But I have to say it's very challenging. However, nowadays, I think with the dental awareness that, most of the patients have, I feel that, I'm having a lot of cases where we are replacing the old, crowns that are very bright to something that is very natural. And most of them are saying, I don't want something that shows, I want something natural. So this actually is helping us as prosthodontists.
People are shifting now to more subtle, I would say, smile.
Yes.
Okay, they don't want to be too fake.
Yes.
Okay, in your opinion, what are the most common mistakes patients do, especially when it comes to these issues?
So I've seen a lot of them come to clinic saying, can we have all of our teeth replaced with veneers? And, you know, I try to explain to them, like, you know, what is actually your reason for coming?
Yeah.
What is it that you don't like about your smile? Can you just explain? And I try to understand what is, you know, the initial issues. So if they, you know, if they say that I'm not happy with the alignment of the teeth, then, you know, veneers, yes, could, let's say, could help in such a situation. But, you know, we would go for a more conservative approach where I would, you know, refer those kind of cases to orthodontists. Others where, you know, they have beautifully aligned teeth and they're like, I'm not happy with the shade. Can we, you know, put veneers? And I'm like, you know, we can go for something very conservative, such as bleaching, rather than preparing your teeth and, you know, going aggressive approach. So, you know, trying to be conservative as much as we can.
Okay. And if you can have one final word, advice for our viewers, what would it be?
Definitely try to choose your dentist wisely.
Yes.
Try to understand what is your main issue that you actually want to address. And make sure that, you know how to take care of your teeth before, you know, going for such a complex work, because you want something to stay for as long as possible. So try to stay away from trends and see what actually is, you know, suitable for you.
For you, exactly. Dr. Balqees, Almomen, thank you so much for all the valuable information that you shared with us. Unfortunately, that's all the time we have. Hopefully, we'll be able to host you again in the future.
Inshallah.
We wish you good luck, and thank you for making people smile, basically. Thank you for drawing a nice smile on people.
Thank you so much.
Thank you so much. Dear viewers, we still have more to come. Please stay with us. We'll be right back.